Hey everyone, in a world where just about everything is at our fingertips, our healthcare is catching up too. Today, we're jumping right into the world of at-home diagnostics, and we're going to break down exactly how to use the iCare HSV-2 rapid test from JAL Medical.
So, here's what we're going to cover. First, we'll get a clear picture of what HSV-2 infection is all about. Then, we'll look at why at-home testing is such a game changer. After that, I'll walk you through using the iCare test step by step. And finally, we'll demystify what your results actually mean. Simple as that.
All right, let's get started. To really understand why a test like this is so important, we have to first talk about the virus itself. This is the why behind the whole thing.
So, Herpes Simplex Virus 2, or HSV-2, is an incredibly common STI. And yeah, it's known for causing some pretty uncomfortable sores. But here's the thing that catches so many people off guard. A lot of the time, it's completely asymptomatic. That means zero symptoms, none. And that right there is why just waiting for signs isn't enough and why testing is so crucial.
Now, you've probably heard of cold sores, right? Well, that's usually HSV-1. It's really easy to get them confused, but they are different. HSV-1 is what you typically associate with oral herpes, spreading through things like saliva. HSV-2, on the other hand, is the primary cause of genital herpes, and it's almost always transmitted through sexual contact. Knowing which is which really matters.
Okay, listen up, because this is probably the single most important takeaway. Most of the time, the virus isn't spread during a visible outbreak. It's spread during what's called asymptomatic shedding. That's when the virus is active on the skin, but there are no sores, no blisters, nothing to see. This means you just can't rely on symptoms to know what's going on.
So, if symptoms aren't a reliable guide, how in the world are you supposed to get clarity? Well, that's where at-home testing comes in. It really offers a whole new level of convenience and, honestly, control over your own health.
And the benefits are pretty obvious, right? You get total privacy and confidentiality. You can do it from the comfort of your own home, on your own time. You get your results in just a few minutes. And, most importantly, it gives you the power to make proactive, informed decisions about your health.
And this brings us right to the kit we're talking about today, the iCare Herpes 2 Rapid Test from JAL Medical. It's designed to wrap up all those benefits, the privacy, the speed, the convenience, into one simple, easy-to-use package.
So how does this whole thing actually work? Let's walk through it together. I promise, you'll see just how easy and straightforward it is. No stress.
Okay, step 1 is all about prep. First things first, grab that alcohol pad and give your fingertip a good cleaning. Then, you'll take the lancet, that's the little poker, and twist off the protective cap. Finally, just press it firmly against the side of your clean finger. You'll feel a tiny prick.
Right after you use the lancet, your goal is just to get one small, round drop of blood. If you need to, you can gently squeeze or massage your finger a bit to help it form.
Now it's time to collect that sample. Take the little pipette that's included and draw up the blood. Okay, this part is super important. You want to fill it exactly to that black line, not above it. Getting the amount just right is key for an accurate result.
All right, once you've got your sample in the pipette, carefully squeeze it all into that little circular well on the test cassette. You'll see it marked with an S. Then, immediately, you'll add 2 drops of the buffer solution from the bottle right on top of it. That buffer is what helps everything flow and get the test started.
And now, for the easiest and maybe hardest part, you wait. Set a timer on your phone for 15 minutes. You can read the result anytime between 15 and 20 minutes. But, and this is crucial, do not read it after 20 minutes have passed. The result won't be reliable then. Okay, your timer just went off. It's time to see your result. So let's break down exactly what you're looking for in that little window.
So you'll see 2 letters in the results window, C for control and T for test. Think of the C line as a quality check. It has to show up for the test to be valid. It's basically the test saying, hey, I'm working correctly. Your result is all about whether or not a line also shows up next to the T.
Let's look at the 3 possibilities. If you see 2 lines, one at C and one at T, that's a positive result. It means the test detected antibodies to HSV-2. If you see only 1 line, at C, that's a negative result. And finally, if you don't see a C line at all, even if there's a T line, the test is invalid. You'll need to redo it with a new kit.
So what happens next? Well, it's really important to remember this is a screening test, not a final diagnosis. So if you do get a positive result, the very next step should be to schedule a visit with your doctor. They can talk you through it, probably run a confirmatory test, and discuss what comes next.
And that's pretty much the whole shebang.
You can see how tools like the iCare test from JAL Medical really put powerful information right into your hands, making it easier than ever to take charge of your health. So, that leaves just one final question for you to think about. Now that you're informed, what's your next step? Thanks so much for tuning in.